Dr. Devi Nampiaparampil joins us right now. What she makes of this. Doctor, you've seen this, you know it, you get the signs. I was talking to a top neurologist who told me these issues, and as seen in his gait, his walk, what he's forgetting, his mind wandering. We mean no ill, but it's accelerating. Is it, in your eyes?
It looks to me like it's accelerating. Also, if we think about President Biden's medical history, he has risk factors to have neurologic issues. So he has atrial fibrillation. It's a heart arrhythmia, which you form blood clots, and those could potentially, if they go to the brain, cause strokes. So you can see some of these symptoms if a person has a stroke or multiple little strokes. Now, he also is on blood thinners to try to prevent that. But the thing is, he's had some near falls. If he's had falls where he's hit his head in the past, that also puts him at risk for brain injury, concussion. If he's on blood thinners and he has any of those things happen, then he's at risk for a subdural hematoma, which also can cause some of these symptoms, including the word finding difficulties and memory loss. So with all of those things, he's already at significant risk. And then when you look at this, for example, a lot of people are attributing this to age. I actually think it's more consistent. Some of these symptoms are more consistent with a medical issue than with age. So, for example, with memory issues related to age, people usually, they have more trouble maybe with retrieving memories. It takes them a little longer. It's like a cluttered garage where you're trying to look for information or look for something, but you find it. It just took a little bit longer. But here, sometimes it seems like it's hard for him to ever retrieve that information. So sometimes that can happen if there's been a destructive process, the file isn't there, or you have a problem maybe storing information, like you haven't been able to hit the control save on certain things. And some of that can also do with attention and focus. Like that can happen in normal life too, where, for example, if somebody comes up to me and says their name, I've never met them before, I might not remember their name the next time I see them because I didn't save that information. It wasn't high priority to me. But remembering when your son might have passed, that's very high priority. So that should be something that should be saved.
And I also think, Doctor, and you're the expert, but having seen this in my own family, extended family, it's frustrating and it's maddening and it scares you to the point you snap at people. They say, well, honey, you're doing this, and he doesn't want to hear it. And the behavior is anger and lashing out, as I think he did last night, to say, damn it, I'm going to have a press conference and tell them a thing or two. He made the situation worse. I'm told that the staff was saying, Mr. President, I don't think that's a great idea. Did it anyway. So we're seeing another manifestation of this that, again, a neurologist tells me is a classic behavior. Not in all cases, but in accelerating cases, definitely. So what are you seeing in the weeks and months ahead?
Well, I agree with you. I mean, that can happen for two different reasons. So sometimes it could be that the person is not aware. This happens also when people have hearing deficits, so it could be for a different reason, separately. Like a person doesn't hear what someone's told them, so they don't know that, it can look like memory loss. They don't know that something's actually gone wrong or that someone told them to do something. So sometimes a person is defensive because they're not aware of what happened. But the second thing is it could be the actual process itself. If somebody has a medical problem, that also could be affecting their thinking and judgment and memory, just generally speaking. But if it is something like that, usually if the person is not being evaluated and treated for the problem, it progresses. Somebody has to intervene, whether it's the person themselves or the doctors and a healthcare system that's working with the person.
Yeah, it's sad. Like I always tell people, regardless of your politics and all this, something like this does, tug at your heart as well. But again, maybe everything will be fine. It just doesn't look that way for the time being. I like your garage analogy. That's a very clever one. I'm going to steal that from you, Doctor. But always good seeing you. Thank you very much.
Thank you.